Imagine waking up one morning with a fever of 104 degrees. Your head is splitting. Your body is shaking. You can't keep food down. Every joint feels like it's being crushed from the inside. Now imagine this is happening in 3000 BC. There is no hospital within driving distance. There is no driving distance. There is no doctor, no pharmacy, no antibiotic, no diagnosis, no blood test, no understanding whatsoever of what is happening inside your body. What walks through your door instead is a person carrying animal bones, dried herbs, and a chant they learned from someone who learned it from someone who learned it from the dead. And here's the question that has haunted historians, doctors, and evolutionary biologists for generations. Did it work? The answer is not simple. And buried inside that answer is a discovery so surprising that when modern researchers first encountered it, they refused to believe the data. Because what ancient healers stumbled onto, without microscopes, without chemistry, without any understanding of the human body, occasionally worked better than anything science could explain. But before we get to that, we have to understand just how bad it actually was. Getting sick in the ancient world was not like getting sick today. Today, if you develop a bacterial infection, you take a 10-day course of antibiotics and move on with your life. In ancient Egypt, in ancient Rome, in medieval Europe, that same infection could kill you in 72 hours, slowly, painfully, in front of your family, with nothing anyone could do. The leading causes of death in the ancient world weren't war. They weren't famine. They were the things we have almost entirely forgotten how to fear. Infected wounds, dysentery, pneumonia, sepsis from a cut that got dirty, childbirth, a tooth abscess that spread to the brain. Ordinary, fixable, utterly mundane things that killed millions of people across thousands of years. And nobody knew why. Not because ancient people were stupid. They weren't. The people who built the pyramids, who mapped the stars, who wrote legal codes and philosophical treatises and architectural masterpieces, these were not primitive minds. They were brilliant minds working without the single most important piece of information in the history of medicine. They didn't know that invisible living organisms cause disease. The germ theory of illness wasn't confirmed until 1861, when Louis Pasteur published his experiments, proving that microorganisms were responsible for infection and decay. Before that moment, for the entire preceding history of human civilization, every single explanation for why people got sick was wrong. Ancient Egyptians believed illness was caused by evil spirits entering the body through the nose and mouth during sleep. Mesopotamian physicians thought disease was divine punishment, the gods withdrawing their protection from someone who had sinned. Ancient Greeks believed illness came from imbalances in four bodily fluids they called humors: blood, phlegm, yellow bile, and black bile. Medieval European doctors bled patients to restore these balances, often accelerating their deaths. Every culture, every era, the same fundamental mistake: wrong cause, wrong treatment, wrong outcome for thousands of years. And yet, somehow people survived. Here is where it gets strange. When archaeologists began excavating ancient burial sites with modern tools and modern understanding, they expected to find evidence of nothing but suffering, mass casualties, bodies with no signs of medical intervention, the straightforward story of a world without medicine. What they found was something else entirely. At Shanidar Cave in Iraq, the same site where the 40,000-year-old Neanderthal with the withered arm was found, researchers discovered pollen deposits around several burials, specific pollen, from plants that are still used in herbal medicine today: ephedra, groundsel, grape hyacinth, plants with real, documentable pharmacological properties. Someone had placed medicinal plants around their dead, which means someone understood, on some level, that these plants did something to the human body. In ancient Egypt, the Ebers papyrus, written around 1550 BC and one of the oldest medical documents ever discovered, describes over 700 treatments using substances that included honey, willow bark, garlic, and moldy bread applied to infected wounds. Honey, willow bark, garlic, moldy bread. These are not random folk remedies. Honey is a powerful antimicrobial agent. Its low water content and hydrogen peroxide production kill bacteria. Willow bark contains salicin, the active compound in aspirin. Garlic contains allicin, which has documented antibiotic properties. And moldy bread? Moldy bread contains penicillium fungi. Alexander Fleming didn't discover penicillin until 1928. Ancient Egyptian physicians were applying a crude version of it to infected wounds 3,000 years earlier, with no understanding of why it worked, simply because they had noticed that it helped. This is the pattern that keeps appearing across the ancient world. No theory, no understanding, but results. Accidental, inconsistent, sometimes miraculous results, achieved by people working entirely without the framework that would have explained what they were doing. But then something strange happened when researchers began analyzing ancient treatments more systematically. Because some ancient medicine didn't just accidentally work. Some of it worked in ways that seemed to defy the available chemistry entirely. In the 1970s, a team of researchers studying ancient Peruvian trepanation, the practice of drilling or scraping holes in the living skull, expected to find catastrophic mortality rates. This was brain surgery, without anesthesia, without sterile conditions, without antibiotics, performed with stone tools or copper instruments by people who believed they were releasing evil spirits. The mortality data was astonishing. Skulls from the Inca period showed survival rates of up to 80%. The bone around the holes showed evidence of healing, new growth, remodeling, long-term recovery. Some patients had undergone the procedure multiple times. One skull showed 5 separate trepanation sites, all healed, indicating a person who survived 5 separate ancient brain surgeries and lived for years afterward. Modern neurosurgeons reviewing the data were quietly stunned. In sterile operating theaters with general anesthesia and antibiotics on standby, contemporary trepanation survival rates aren't dramatically higher than what these ancient Peruvian surgeons achieved with stone tools and belief. How? Part of the answer is surgical skill. These practitioners had performed the procedure hundreds of times and had developed genuine technical expertise. Part of it is that trepanation, performed correctly, doesn't necessarily penetrate the brain itself. But part of the answer, the part that took researchers decades to fully accept, was something else. Something invisible. Something that had nothing to do with the tools, the plants, or the procedures at all. In 1955, a physician named Henry Beecher published a paper that shook the medical world. Beecher had been studying pain management during World War II, and he noticed something that didn't fit any existing model. Wounded soldiers in severe pain, wounds that should have required significant morphine, often reported dramatic relief after receiving nothing more than saline injections. Not because they were deceived about the contents, but because the ritual of receiving treatment, the needle, the attention, the authority of the medical figure, the expectation of relief, triggered genuine, measurable changes in the body's pain response. The placebo effect is real. It is not imagination. It is not weakness. It is the human nervous system responding to the expectation of healing by releasing its own internal chemistry. Endorphins, dopamine, reduced cortisol, changes in immune function. And the ancient world, without knowing any of this, had built an entire medical system around maximizing it. The elaborate rituals, the chanting, the symbolic objects, the healer's authority, the community gathered around the sick person, the certainty with which the treatment was administered. Every element of ancient medicine that seems irrational from a modern biochemical standpoint turns out to be, from a neurological standpoint, precisely the right delivery mechanism for activating the body's own healing response. When an ancient Egyptian priest performed a healing ritual over a feverish patient, burning incense, reciting invocations, applying poultices with complete and absolute confidence, the patient's nervous system was receiving a powerful signal. Help has arrived, the threat is being addressed, recovery is coming. That signal alone produced measurable physiological effects. We have spent a century dismissing this as superstition. Scientists are now discovering it may have been one of the most sophisticated healing technologies ever deployed, one that didn't require anyone to understand it to use it perfectly. But the most important thing ancient medicine got right wasn't a plant, a procedure, or a ritual. It was a decision about who was responsible for the sick person. In the modern medical system, illness is handled by professionals. You leave your home, go to a facility, interact with strangers who treat you according to protocols, and return. The community around you, your family, your neighbors, your social world, plays a largely passive role. Bring soup, send flowers, wait. In the ancient world, illness was a community event. When someone in a hunter-gatherer group got sick, the group reorganized around them. People took over their tasks. Someone stayed with them through the night. Healers came not just to administer treatment, but to sit with the sick person, to tell them stories, to maintain connection between the individual and the group. At the moment when illness was most likely to produce the deadly combination of physical deterioration and social isolation. Modern medicine has known for decades that social connection directly affects health outcomes. Loneliness is now classified as a risk factor comparable to smoking 15 cigarettes a day. Social isolation suppresses immune function, increases inflammation, and accelerates the progression of disease. People with strong social support systems recover faster from illness, surgery, and injury at rates that cannot be fully explained by any other variable. Ancient healers didn't know any of the biology, but they built the solution into the structure of how illness was handled. The sick person was never alone. The healer was never a stranger. The treatment was never delivered in isolation from the community that made the person want to recover. They got the biology wrong. They got the mechanism wrong. They got the cause wrong. But they got the most important thing exactly right. So what happened if you got sick in ancient times? Sometimes you died from something completely treatable by modern standards. A tooth infection, a superficial wound, a fever that 3 days of antibiotics would have ended in a morning. But sometimes, more often than the evidence suggests we should expect, you survived. Through plants that worked without anyone understanding why, through procedures that modern surgeons perform in sterile theaters and achieve comparable results to Stone Age practitioners, through rituals that activated your own nervous system's healing capacity, through the presence of a community that refused to let illness become isolation. Ancient medicine was not primitive in the way we assume. It was wrong about almost everything that could be tested, and right, almost accidentally, about the things that couldn't be. The healer who walked through your door in 3000 BC with animal bones and dried herbs and a chant learned from the dead, they didn't understand what they were doing. But sitting beside you through the night, refusing to leave, telling you that you were going to survive, that part worked. It still does.